on the street. Okay, thank you. Walking on the street, so someone just stopped me. If you don't know Bexley, it's a very affluent, if I allowed to put that, community, mostly white population. So I would get stopped, say, do you live in Bexley? I say, yes. He said, oh. So then I asked that person, do you live in Bexley? She was like, why you ask me? I was saying, then why do you ask me? Right? And she was like, oh, Bob, confused. And I said, have a nice day. So I walked away. And when I take my son to the playground to play, so I got asked, this is all real, not just joking. How much you charge for babysitting? So I said, oh, I don't think you can afford me. Then she was, oh, $15? That's pre-pandemic. So 15 is pretty good. Oftentimes got babysitter only get paid at 12, right? I said, oh no. I said, well, I'm a little bit more expensive than that. I said, my each session, 45 minutes, $150. So anyway, I confused them a lot. So this kind of microaggression, it's also create a lot of kids. So a good friend who is the mixed couple, one is Indian Asian, another one Japanese Asian. So they used to live in Bexley. Their kids, you can imagine Indian and Japanese Asian. So the kids are a little bit brownish. So they got in Bexley school got called poop. And the girls triplet came home crying, asked mom, why I'm not brown? Isn't that sad? So how that have impact on kids' experiences? So they decided to move out to Dublin here, thinking better environment because more Asian population here. So kudos to them. So anyway, so all this kind of microaggression, not just me, my kids, my friends' kids, they still experience that. Okay, so how that can translate into a big health concern, we will see that in our clinical cases. Okay. So anyway, so access and exposure, I will let you. So for the data, we don't see a lot of this data related to Asian Americans. Why? Can you guys tell me why? Data is not collected. Why data is not collected?
Is it because of the fact that some Asian Americans may be grouped with white people?
So it's very interesting when we want to do, that's actually one of the reasons. But at the same time, I remember when I was at Ohio State. So I said, I want to do some research study on international students. So my faculty member told me, no one cares about international students. Why not? Population-wise, it's too little.
Very small.
Okay.
So in the chat, not to interrupt.
Yeah.
Cormunos had stated it's the model minority myth.
Yeah, so we're going to go to that. Yes. Because so that's actually, Cora just forced me to go to my clinical intervention. Okay, well that's okay. But anyway, sorry. We do have some data, but not that much. So first of all, I remember when I tried to apply the grant for Asian American study, but it's not easy for us to get money because such population is very, very small. It's not, they want the money to be impact, and also the silence from the Asian community, just in general. So we don't really voice out. And also one time I was talking to, as Cora said, NIMH, because I was in the University of Alaska. So I was, we got $1 million for Native Alaska mental health and suicide intervention. So now I just asked to our counterparty from the NIMH, I said, if I want to do something for the Asian American, for the mental health, do we get how's the funding allocation there? Now he said, do you guys need that? So that's the general idea. So maybe you, but Alaska natives have less population, but why they think they need it? It's a lot of political advocacy there. So how the model minority concept had hurt Asian American community. That's the topic that we're going to go into. But anyway, because of all these reasons, we don't really have a lot of data out there. Even we have data out there, guess what? It's some of them contradict to each other. Say, you know what, we don't really experience any access and there's no such thing. But some say, yes, we do have a lot of huge impact by the adverse experience on the kids. So why is that? Why the data says different stories?
Is it reporting? Just the reporting?
And also in the population, right? Who you study with. So geographically, where do you do the study? And who do you do the study? So during the lunchtime, I have a little bit time chat to a couple friends here. I said, did you ever come across any Asian population needs your help? She said, no, not really. So why is that? So I don't know, why is that?
Culturally, Asians don't speak to anyone outside. They make sure that they deal with their issues internally.
Yes, that's one. There's a lot, it's a lot of shame involved, and also immigration status. Yeah. So that's one thing we don't really know in our cases. So anyway, so mixed findings about Asian American Pacific Islanders. Okay, so we don't know what's going on. Some say yes, we really need it. Some say no, we don't experience too much about adverse experiences as we're growing up. So how we deal with this data? How do we? So should we do nothing? Or just say, well, they say so, let's do something with it. So I would really encourage, maybe we need to do more, collect more data. We need to have more involvement in the community, really go into the community to understand Asian Americans' stories. So that's what I'm going to talk to you. So anyway, so on the concept, whatever the data told us, it's a little bit wrong. We don't really know the whole picture yet. That's all clinical. All this is, you can read it. It's all structural inequality. Since we don't get too much funding, we can't really do study. You know, faculty members, right? We don't get money. We can't really produce data. Lack of data, lack of the communication with other, you know, for example, if I said, I want to do Asian American study, but guess who I'm going to be incorporated working with? Another Asian American faculty member. I don't get to work with a different, so because when I say I want to work with an African American counterpart, so they say the experience is so different, but do we really have very different experiences? I don't know. It's how we read it, right? I know I told my friend who she's white, her husband is Black, so the son is Black. So both our kids are mixed. So, but our experience are so different. So I told her, I said, Davida, we gotta do something for our kids. I say, because I know John will never be stopped by the police officer, worried about going to get killed. But Jude, that little beautiful boy, black boy, well, I said, we gotta work together. We should not say, oh, you're black, I'm Asian. So that's not, we're not going to go no places if we don't work together. But anyway, since lack of data, the data is not integrated. So when we draw the conclusion from the data, something is not quite right. So when we use that data, when the data is not quite right, we use that data to apply to our health policies. You can see how wrong that can get. Okay. So we just, so that whole thing, they are going to introduce two cases to you. This is all real case. So that's what Cora said. Besides all this data, also doesn't matter it's mainstream or academic. The model minority got brought up by Peterson in 1966. It hurt Asian communities a big time. So when you guys look at Asian Americans, what do you think about us?
Academically gifted.
Successful, yeah, smart. Okay, anything else? Quiet, yeah. Disciplined. Anything else? Focused. Anything?
High achievers.
High achiever. Anything else?
Generational differences.
Yeah, different generation. That's the outliner. We don't want to say. Okay, you all say so, right? We are deemed socioeconomically, academically successful. So how could a person like this have ever experienced any adverse experiences during the childhood, right? How could a person standing here, fit, dress nice, have a couple of nice jewelries, how could she have any adverse experiences? In my childhood, no, I don't. I did not, because I should grow up in Taiwan. I'm the majority. But guess what? I experienced a lot of adverse experiences stuff. So am I going to bring that to my son? I said yes, if I'm not intentionally conscious. If not, because I'm a psychologist. So a lot of people, it's not like me. So here's our case. A 24-year-old female of Chinese descent. Her mother was addicted to gambling and also alcohol. So often is not home 3 or 4 days a week. So she was left in the care of nanny or her older sister, who would be physically abusive to her. As a result of these early childhood experiences, she's currently suffering from severe OCD and PTSD. She's one of my patients. If this girl, when she was 8 years old, went to the school showing some distress, what would you do?
I would probably refer her because if I'm the teacher in this situation, there would be some things that would be outliers, either her change in behavior or lack thereof. So there would be someone that I would have to connect her with a social worker for probably an assessment.
Yeah, so sorry, I kind of tricked you guys. First of all, do we even going to notice her or her behaviors?
Not always.
Not always, right? Unfortunately, Asians tend to be the quiet ones. You're not going to bring anything to the family, shame to the family. gotta keep it inside the family. And also, just in general, when the mass majority thinking you should be quiet, you gotta be quiet. The modern minority concept, right? Yeah. So she got missed, right? She had a lot of trouble. I don't even know how she make it through. 24 years old, didn't lost in the system, becoming drug addict, alcohol, addiction, that kind of, I don't know. There's something there, right? So something protective factors there. So that's the thing we gotta look at. But do we want her to be my client? We don't, right? We wish when she was young, we can do something more for her. So I don't know how many of you here have any kids. So when you think about if it's your little girl here, heartbreaking, right? Okay, so let's see this second case. I don't know if I can ask you to read it out for us.
21-year-old female Pakistani descent suffers from chronic PTSD resulting from incest and psychological abuse during childhood, which continued through her teens. Her father had been physically and psychologically abusive to her mom and siblings. In addition, she was sexually abused by her grandfather, while her family remained silent due to cultural taboos and complications from their immigration status.
Okay, this is a really complicated case, multiple layers, right? Not just in the immediate access in the family system, within the family, but also expanded. Okay. So I talked to her. I said, I wish there's someone there, adult there for you, right? But truthfully, when adult there for you, what can she or what can he do? She said she knew when she was 17 what her grandpa did to her was not right, but she could not do anything. She did not want to talk to the teachers what's going on. Why not?
The same as the previous one, it's the shame that comes with this.
Yeah.
And
Also,
then their immigration status too. I mean,
yeah.
She doesn't want her grandfather to be deported.
The mother wasn't the one undocumented. I actually, it's very interesting. I see a lot my clients, their parents are undocumented. So what are you gonna do, right? As a child, you have such traumas placed on you. She knew something not right there, but she could not do anything because she didn't want her mom to be deported. And the father was severe alcoholic.
So in this case, as we say, like, these things are happening within the home, do you think that it could be possible that it happened with her mom and her mom kept it a secret as well, so that generational
Yes,
barrier?
we don't know, right? But I asked, she said, my mom is walking shelled without a soul.
Okay.
That's how she described it, yeah. So, by the way, I did not pick all the extreme cases for you. This is very typical cases I saw. I see at my clinical experiences. Okay. So does that give you a little bit better idea about access experience among Asian American? Yeah. So most of my clients, I know, but this is the ones came to the clinic, eventually seeking for help. But think about all the lost ones. Actually, my personal has a friend in here. He used to own a restaurant. The father was severe, migration, that kind of thing. And father was not doing too good because immigration status, that kind of thing. Then he got into, as a young age, he got into drugs. So just a couple years ago, he overdosed at 35. Fellow Taiwanese. I mean, he was born here, but the father was originally from Taiwan. So all these stories happen in the clinical setting, in our real life. But this kind of data, if you call them data, they did not get to present it. So now, how do we do it? I don't know how we have make the gap not there. Okay, so just wanna, there's a cute one, right? Me and my son. Okay, so both look really happy. But last year, there's one incident happened to us. We were like dumbfounded. When we talk about microaggression, that's okay. It's not okay, by the way. I say, we have all the strengths I can deal, I have a sense of humor. And I got trained really well in multiculturalism. So, but last year, one incident happened. We both did not know how to initially cope with it. This little boy and me would be your client. We will go to see you because we received email from the school saying, Johnny gotta go to English as a second language class. You need to understand, he speaks perfect English. And we're not pushing him too much. He's like reading his first grader. So his reading ability was at 86 percentile nationwide. His math was 96. Unfortunately, that fits the model minority age are good at with math. But we didn't even know, why do we even receive that accommodation? So ended up, school want to be nice to us. I was like, why do you need to be nice to us? They want to help us. But we don't even know, why do we need help, right? So there's an assumption. So the system placed discrimination, assumption on certain group of peoples. And they didn't even realize that. Why challenge in the school district, they didn't even realize that was racism. So how much that have happened on the minorities' life? How the system was set up. For example, they say, oh, we need English as after school program. So they target, they send out email to the African-American students thinking they need more help. We've got to help them more because we are kind-hearted. So that unintentional racism placed by the system, it could be really hurtful. So anyway, so my son and me, we need your intervention because we got hurt. Because my son said, Mommy, and my English is really poor. So they don't think I'm good enough. A 6-year-old boy asking you about that. Isn't it heartbreaking? So now we come to you. You're our savior. You're going to be our therapist, social worker, whatsoever. How going to be your attitude in helping us handling the situation, right? So we really encourage you have some cultural considerations and also practice at the individual level, so-called cultural humanity. Make yourself the student instead of the teacher. Have the learning mind. Say, let me learn from this pair of the parent and son. What kind of help? How can I empower them, right? Two, I don't know if we say fighting the system or how we to advocate for their well-being. So it's really, in my case, that's what we need, right? So how can you work with me? So it's really important to be culturally humble, means I'm willing to learn, because we don't know a lot. We want to know what my client, what's the strengths they have. Maybe we can get together, find a way to educate our system, right? In this case, it's best school district, how we can do that. So here's our acronym for humble. H is hold yourself accountable, right? We really need to re-examine our biases and assumptions. I totally understand myself, not totally. I need to hold myself accountable. When I see blonde, not assuming they're stupid, right? So I'm just joking. Okay. One couple times when I was working with my son's godfather, who happened to be Black. So then my friends found out he is the godfather of my son. One just asked me, why you want a Black person to be your son's godfather? I was like, why not, right? So sometimes we really need to, because when he said that, it's an assumption, there's a bias behind it. So I also need to hold myself accountable. How many times I walking on the street, if I see someone Asian coming towards me, I assuming he or she going to be certain ways, right? We all have that. So that's our human nature, but we really need to hold ourselves accountable by not assume too much. Okay, second one, you is understanding your own culture and background and how I be influenced by the background, by my culture, because I did in the very beginning when I first came to this culture, I was really quiet because my culture taught me, don't talk too much unless you have a fabulous ideas. Little I know, in my PhD class, all of my other counterparts, students, they just talk all the time. To me, they're talking nonsense. They did not really contribute too much, but ended up one day, my teacher said, for the ones who did not talk too much, you're stealing ideas from others. You need to contribute. I was like, oh my gosh. I thought she would thought I am humble and smart. No, she actually thought I was like stealing other people's ideas. So guess what? I'm now very Americanized. I talking nonsense all the time now. So gotta learn to adapt, right? Okay. So the aim is to maintain a commitment to lifelong training and to be and learning. To be honest with you, before this Access Summit, I don't even know what Access means. But I learned something. I decided to commit to learn more about Access and PACES. And we all gotta learn something. Okay, B, break down power imbalance. So that's a really, really big topic. So how we can do that? I will leave to other experts. Learn about historical oppression and inequality, or the background culture and the life experiences. So that's what I'm doing. I just talk to you about my own life experience. It's not so much I want to share because, but make it more personal. So, and also that's one thing we want to learn from our clients or whoever we serve, ask them to tell you about their personal life stories. By listening, that's the most powerful tool of healing. They need to have a chance to tell you about their stories. So E, emphasize empathy and respect. I will say second one is the most, because even me and my son were struggling in that moment about going to the English. We were very, very vulnerable. It was very hurtful. But I don't want you to patronize me, right? I want you to still respect me, understanding what have been gone through. So a lot of, in general, people will say, oh, poor you, right? We don't need you to say that to us because unfortunately, we want you to respect us, help us to discover and empower us. Now how we can go back to who we were to advocate for ourselves and also maybe do something good for the society. Okay, so that's basic learner's mindset. So how community level, that's individual level, right? How can we do at a community level? What do you think?
I think one of the things that needs to happen is if you don't know, right? Ask. I think we were talking about that earlier. It's okay to ask questions.
Yes.
If you don't know, so that you're not making an assumption, and sometimes the assumptions can be really ignorant that we think. And then I think trying to befriend people from different cultures, you're able to learn things if you're not comfortable with asking those questions.
Yes.
And I think cultural diversity in the workforce, is really important, just to have those voices heard.
Yes, and it's really good if you can work with diversity, right? So, but anyway, long story short, go back to my son and with story, just use that. So ended up, it feels like really, we decided to do something for the community and for us. We want them to get to know us. So we actually create. Don't say we only work with this ethnicity or that. Cross-border, because during the collaboration, I understand myself more. I also understand how my friends sees me. And also I understand my friends more, how I can work with them. How can we all work together to do something good for the greater society? So basic, we're just gonna work together, all learned from each other. So that's our ending for today. Really appreciate it. So if you have any questions, because our time is kind of up, right? Okay. Okay.
I know, I feel like I've been running my mouth.
No.
I'm the moderator as well, but I really want to say, Jacqueline, I appreciate this conversation, because I think it leaves, you know, folks with questions, and then also the answer to what I can do next in case there's, you know, ever met with certain adversities for others. I think it's really important.
Yeah, I really appreciate it. She's my best audience. All these other white people, they are so intimidated. They don't know. So they don't know what they should say. Now they, you know, we're not going to get mad at them, right? So I'm just joking.
Question,
Yeah.
I think,
So
it's either in like too dumb or anything like that, or offensive, like, you know. But I do think, because I know, like, even growing up, right? It's like I never thought that I could get a sunburn, right? And
Yeah.
I know that this is I went to South Carolina. We stayed out the whole time. I had a sunburn, like my skin really bubbled up, and I was like, oh my gosh. I always thought that like it was only for white people. So even something as small as that, I'm like, oh, so if we're all people, regardless of what, right? So there's certain things just don't mean that it happens for certain people.
yeah. But I do think it's important to just ask, and also I kind of joke about white people that kind, because there's a concept called white fragility, because you guys so worried we're going to be upset at you, and also you get blamed, which is not fair. So here's another story between one of my contractors. So anyway, we do some work, and then he was like, Shuping, I pay cash, so I'm going to stereotype Asian a lot. So I said, do I get better price? He said, yes. So anyway, I said, then when we finalized how much I need to pay him, he was like, he take out his iPad, the iPhone, try to do the, and I was like, Travis, he's like 30-something white guy. I was like, Travis, 2050. He was like, how did you get it? I was like, I'm Asian. I was like, I'm good at math. Then he was like, are you allowed to say that? I said, I'm sorry, I am allowed, but not you. So we totally understand on the other side, but we want to get on the same side. There's no, I think both sides need to be all a little bit less sensitive. And let's work together, have a little bit sense of humor. Yeah, because a lot of things I don't know, trust me, I don't know African-American will get sunburned until I seen the movie, seen a program called Us. Yeah, there was episode talking about that. Then I went to a friend of mine who's black. I said, do you guys really get sunburned? He said, yes. Yeah, but anyway, so I really appreciate this. Any questions?
In the chat, Cora Luna says that you are a very good presenter. It was a great presentation. You're funny, and thank you for sharing your personal story.
Okay, I appreciate that. Yeah. So, nothing? So now
Well,
was,
it's not really like a question, but I'm just like interested in your thoughts. Like, since Asian is like so broad,
yeah.
What do you think can be done to like account for all those differences?
I would say don't even try to do it. There's no way, right? It's just like when you use the AAPI, as such, think about when you use the AAPI, you actually compose the half the earth. So how are you going to use one term to say we're going to be able to exhaust the characteristics of the half earth of the population? Truthfully, when you go from the East Asia to the Middle Asia, that's whole South Asia, that's more than half the populations. Yeah, I will, but guess what? Treat that individual as an individual with the consideration of his or her own cultural background. That's always, because I won't assume all you 35 white people here, you guys are all the same, right? So That's not, and I won't try to come up any characteristics to describe maybe Italian American, Irish. I don't even know who you are, so that kind of thing. So I would say let's just respect, listen to the story of individuals with the mindset, the consideration of the cultural background. Yeah, thank you.
Are you finding funding coming for, you're saying lack of data, lack of this, to really understand the situation within the AAPI, which I don't really like that term, but.
Yeah, I don't mean it. That's the
So,
best we can have now.
funding is going to be critical. Where do you see that coming from?
So I actually should have a Cora on the line. She's good at getting funding for, she just invited me and Dr. Sampilo to participate at another, just like going to get a grant. So I think that's what we're gonna do. Just, and also for better or worse, this wave of anti-Asian crime, we did get more funding now, allocated to Asian American AAPI studies. So, and also just happened, here's another good news is Facebook, the owner of Facebook, whatever, what's his name? His wife is, Mark Zuckerberg's wife is actually Chinese American. So their family actually put up some good money to advocate for Asian Americans, AAPIs, yeah.
I know that during the pandemic, the AAPI community suffered greatly, like especially as it related to a lot of violence because of some of the misinformation that was shared. And so I think more or less my comment is just to let folks know that it wasn't just in that, but it's ongoing for a lot of folks that are immigrants because of the status of their citizenship.
Yeah.
It
So-
goes a little deeper than that even. It's, I helped organize some of the anti-Asian violent rallies in town. And the politics also is very much plays into how people work together or not work together. So the origins, where they come from, whether they lived here forever, then
Just
where you
landed.
from, where you from, question is always out there. Those microaggressive behaviors. But one thing that really, the AAPI and the other folks were on one side, and there's these other folks that are doing some other stuff, and the two shall not mix.
It's very, I'm involved with Asian festival, right?
Yeah.
Just within our group, there's a lot of politics. Everything is all about politics. So that's why we, the final just stay here, policy level. I'm going to use this doctor, whoever, I forgot his name, terrible with names. He's an Asian American himself, migrated from, I think, one of the South America countries, but he make it big time. He owns the LA Times now. He said something after the entire America. He said, we Asian Americans need to mobilize ourselves to be more actively participating in the policy level making. So I think that's it's a wake up call for Asian Americans. Silence is not going to take us too long. Yeah.
So knowing that silence is a cultural, right, trait,
Yeah.
how does that, so I'm sure like for your generation, it might stay, right? But for your son and maybe your son's children, is that where you see the change?
So unfortunately, it's very interesting. We thought the second generation would do better, third generation, not necessary, because the culture just ingrained it. So I think it's just a mindset we gotta change. Just like I said, I never know my silence was deemed as not contributing, but stealing other people's ideas. I gotta learn to speak up. I gotta learn to do something. during my son's, because I'm perfectly fine to just have my good life, not involving with my sons, you know, but unfortunately that incident brought me say, you know what, we gotta do something. We gotta do something at a policy level. Tell the school teachers, you cannot say, oh, we have this funding for English as second language class. So we need to find some people. You cannot just go out to find someone who look Asian, right? You gotta, the policy need to be more sophisticated. Yeah, and don't make policy becoming an oppression. Yeah, yeah, yeah. Thank you. So we good? Thank you.
Cora just wanted to add, there is a movement nationwide for Asians to run for political office. We have 2 Asian senators in the Ohio legislation who advocate for Asian issues.
Yeah. So.
One caught COVID twice.
Okay, so I really appreciate you guys and listen to my nonsense. And I thank you for being interested. To be honest with you, I thought in the very beginning I probably have 0 participant because this is the Asian American topic. But I'm really thank you for coming here. Thank you. Yeah. Oh, for the online people, thank you so much as well. Yeah.
Thank you.
She said thank you.